Miss Pillows here for you and your Tatas. Today we'll explore the life cycle of a titty, before, during, and after pregnancy. Turns out, having a baby does a real number on your lady lumps, from the nip to the dip. Will these flagpoles ever be raised again? Let's find out. What happens to boobs during pregnancy?
They swell.
They get bigger. That's like the only reason I want a child is for the tits.
Well, I'm 6.5 months pregnant.
You're finding out. So when you get pregnant, what happens to the breasts?
Well, once you get pregnant, your estrogen and progesterone levels shoot up. So they are preparing that breast to be able to feed a baby. So the fatty tissue in the breast gets larger, the alveoli get larger, everything gets bigger and bigger and bigger and gets very tender. You can have some darkening of the nipple areola complex as well from these hormones.
And then after you breastfeed, what do you think happens to them?
I have no clue.
They don't go back to where they were, do they?
They sag
Tend to fall a little bit.
down to your ankles.
After the milk comes out, sometimes they turn into raisins, maybe not maybe.
Mine's in sag.
I liked you first. So what happens to the breasts after you give birth?
Then the estrogen and progesterone level goes down. So the prolactin and something called oxytocin now come into play, and that's when you're nursing, okay? And that's what helps you create the milk, and by the baby sucking on the breast, it stimulates secretion of the milk as well.
So what happens to the nipples?
The color should go back afterwards, but I do find that sometimes patients who've been breastfeeding, they may find that the nipple is a little bit more protuberant.
Meaning sticking out.
You mean sticking out.
That sounds fun.
Okay, so they fill up with milk and they be leaking and stuff. I just know they be leaking.
So let's talk leakage, lactating.
It's not uncommon to have a little bit of discharge during pregnancy, and that's the colostrum that is developing, which is not milk, okay, but which does have a lot of benefit for the baby, and that's the first thing that the baby receives before the milk comes in.
What about after you stopped breastfeeding?
It is not uncommon to be able to squeeze or identify milk in the breast up to 2 years after you've stopped breastfeeding.
2 years?
2 years. It's still considered normal.
Is there any way to prevent the boob from sagging?
I wish I could tell you there was something. There really isn't. You know, it's pregnancy. It's not necessarily the breastfeeding that causes this change. It's this sort of rapid change and then deflation, and they tend to deflate afterwards. And it's not that the baby sucked the tissue
life out of
your
you?
breast. No, I don't think so.
I still say that mine did.
And you know, everybody's different. This doesn't happen to everybody.
Is there any way to get it back up there?
They go back a little bit afterwards, but some people's breasts go back perfectly, but just as they were before they got pregnant.
Those women.
Okay. Other patients just get droopy, and other patients get droopy and deflated. You know, with age, the breast tends to have less dense tissue and gets more ptotic, droopy. In the old days, this is what they told you to do. All that does is work on the pec muscles. The breast sits on top of the pec muscles. The breast is not a muscle. It is a gland that does not have any kind of this skeletal muscle.
Do you think they ever come back up?
What?
Your boobs.
Oh, yes. They do after surgery.
Are they empty IV bags? Mine are. And how do you feel about your boobs now?
No, I have a pretty good one. Yeah.
Turns out your girls go on a fun and wild journey during pregnancy, from leaky globes to soggy pancakes and back again. Love them and keep them supported at every step. I see you stretched out sports bra and you're going down. Thanks for watching. I'm Miss Pillows here with self-care for growing a pair. Tatas for now.